Welcome back, everybody. As the kids get into the swing of this new school year, many get involved in sports. One thing to watch out for: concussions. Dr. WLUK-TV from Affinity Healthcare Systems gives us some tips on the signs and treatment.
Hi, Amy. I'm Dr. WLUK-TV. I'm a sports medicine physician who does non-surgical orthopedics at the Kennedy Center at Mercy Medical Center. A concussion is a brain injury that changes how the brain normally works. Sports concussions can occur during contact sports like football, hockey, soccer, but they can also occur during recess or gym class as well. During a concussion injury, the brain actually shifts around inside of the skull, which can cause injury to the brain itself, and it's super important that the patient get evaluated, as it can cause severe consequences or symptoms in the injured athlete. Parents, coaches, and even fellow athletes should look for signs of a concussion, and signs of a concussion would include forgetfulness, confusion, dizziness, and balance problems. The athlete can have a difficult time in school, focusing and remembering things. Sensitivity to light and noise can be common. Having problems with sleeping, anxiety, depression. If you think your child had a concussion and is experiencing any post-concussive symptoms, it's important to bring that student or your child in for a medical evaluation. The cornerstone of concussion treatment is physical and mental rest. Physical rest would include not participating in any sports and also resting from recess and gym. Mental rest would include backing off of their school activities and decreasing their screen time at home. The Wisconsin concussion law consists of 3 basic principles. The first one is concussion information that an athlete or guardian must read through and then sign that they've read the information and understand it. The second component is that a parent or a coach, if they suspect the athlete had a concussion, that individual is removed from a practice or game and then not allowed to return that same day. The third part of the law is that that injured athlete needs to be evaluated by a medical provider, then get written clearance to be able to return to practices and game situations. When an athlete is symptom-free without medications, has returned to a full school day without any accommodations, then we gradually return the student to gym, recess, and sports. Baseline testing is a brief test on the computer that measures an athlete's memory, short and long term, and their quickness or their response to action to different questions. If parents suspect their child had a concussion, it's extremely important that they bring the child in for a medical evaluation.